It is the view of the Paho WHO country representative William Adukru that a lot more can be done to reach out to men in Guyana with regards to HIV. At the recent opening of the end-of-term review and development of the HIV strategic plan, Adukru, in outlining his suggestions on the way forward, noted that although women are much more accessible for education, the men should not be sidelined.
We need to expand outreach to men through targeted demand generation. It's easier to reach women because they bring the children to the clinic, we get the opportunity to talk to them, they get the opportunity to talk to us as healthcare workers, and we get the opportunity to have them tested. But men, they do not. So we need to expand outreach to men through some targeted means.
He further added that the implementation of self-testing will reduce the number of persons who are reluctant to get tested because of discrimination and confidentiality issues.
We need to look at and implement self-testing and recency at faith-based organization sites and others. And I think self-testing is a major issue. There are some people who travel, or at least in the early or the latter 80s and the early 90s, and when I was working with Barbados, with the Barbados Ministry of Health, there were people who would travel outside of the country to have their HIV testing done because they didn't want anybody to know their status.
Preliminary data provided by the National AIDS Program Secretariat revealed a decline in the number of persons accessing the voluntary counseling and testing services in 2018 and 2019 when compared to 2017. In 2017, some 57,000 persons accessed the services, while 49,000 and 45,000 persons did same in 2018 and 2019, respectively. The Secretariat has committed to intensifying its VCT campaigns throughout Guyana. The new National HIV Strategic Plan is intended to eliminate the disease by 2030. Tamika Rodney reporting for HGP Nightly News.